Hi, this is Dr. David Greene with PreferredPainCenter.com, where we bring you anything and everything education related for pain management. Today the topic of discussion is how does an epidural steroid injection relieve sciatica pain? Well, let's start with a little bit of background. Sciatica from a disc herniation affects at any one point in time approximately 1% of the population. So if you figure there are over 300 million individuals in the United States, over 3 million people at any one point in time are dealing with sciatica. Sciatica is when a disc herniation occurs and that herniation pushes on a nerve root and pain then flows down the leg of the affected side, right or left. It can be very painful. It can be a burning, searing kind of pain, and it can be incapacitating for individuals. They can be out of work, have to spend some time in bed, take opiate medications, and it can really turn somebody's life upside down. Medications can help, but the objective is to get the patient out of pain and avoid surgery. So epidural steroid injections have been utilized since the 1950s, that's right, over 60 years, for this problem. And they remain the gold standard for non-operative treatment of a disc herniation with sciatica because of that. So let's take a look at what an epidural injection actually does, all right? Here is a crude representation, and I mean that literally, I'm not a very good artist, but this is the spinal cord coming down. And I've shown these nerve roots coming off on either side, okay? And this big square here, let me just show you what I'm talking about, is the disc. So if a piece of disc comes out the back and hits this nerve root as it's coming out from the spine, that can cause inflammation and pain that shoots down that nerve root distribution. That may be down the back of one's leg, it may be down the side, it just depends on which nerve root it is, okay? So the theory behind an epidural steroid injection is that you take this humongous anti-inflammatory medication called cortisone or steroid, and you put it right around this nerve root where it's being pinched. And that bathes and coats the inflamed area with the soothing steroid medication, and it can knock out the pain. Now sometimes it takes more than one injection. It may take a series of 3. And that's why the pain doctor often has the patient come back every week or two to get a repeat injection. If the first one works a little bit, the second one may work a lot. If the first and second don't work at all, then it's not a good idea to have a third one. So that's the theory behind an epidural steroid injection. It doesn't fix the problem at all. So if you think that that's what's going to be fixing it, it's not going to happen. It's a Band-Aid. It's going to mask the problem in the hopes that your body will disintegrate that piece of disc that is pushing on the nerve root. And that does happen a lot of the time. Most patients are able to avoid surgery because that piece of disc disintegrates, the pressure comes off of the nerve root, and then the inflammation and sciatica go away. So they've done studies looking at patients who had an epidural steroid injection and non-operative treatments versus those who underwent surgery, and at 1 year, the results were no different. So, but if you have, deteriorating muscle weakness like a foot drop or something like that, then surgery is indicated and the quotation, all bets are off, right? So you definitely should try and avoid surgery if at all possible. The pain doctors at Arizona Pain are double board certified and fellowship trained. They've done thousands upon thousands of epidural steroid injections, both in the neck, the mid-back, and the low back, for sciatica problems, radiculopathy, spinal stenosis, which epidural steroid injections help with tremendously. So they have multiple locations serving the whole valley and take a ton of insurances, including personal injury, workers' compensation, and self-pay options. So call 602-507-6550 today to make your appointment to discuss an epidural steroid injection. I'm Dr. David Greene with PreferredPainCenter.com. Your pain stops here.